So CAR-Tography is a large international effort that we embarked on more than a year ago, really asking the question, is it enough to really look at only one specific toxicity at a time that arises after CAR T-cell therapy? So most studies, they'll focus either on CRS, they'll focus on ICANS, hematotoxicity, and infections. But can we bring these all together and understand the interdependencies of these different toxicities among each other? And so what we did is we comprehensively mapped day by day these four major toxicities in the first 30 days after CAR T-cell infusion. We did this about 900 patients, looking at more than 32,000 unique patient days, which ultimately yielded more than 125,000 unique toxicity data points. And using this data, this sort of very large data granularity, we were then able to really derive new metrics to describe toxicities. The first is a more quantitative metric where we take an area under the curve view of early CAR T-cell toxicity, which we call the cumulative toxicity index, or CTI. And this metric essentially looks at all these four major toxicity domains at the same time and provides a more holistic metric of early CAR T-cell toxicity. And we can use this metric to now describe toxicity across products. We see specific products that are associated with higher sort of CTI, such as Brexucell for mantle cell lymphoma and ALL, and Axicell for large B-cell lymphoma. Others that are associated with lesser CTI, such as Lysocell. And so we can use this metric to really describe that. And then what we ended up doing is leveraging this granular data, applying an unsupervised learning technique called latent trajectory class analysis, pioneered by one of our biostatisticians in the lab, to really understand how these different toxicities relate to each other over time, in severity, and in relation to each other. And doing that revealed that there's three specific clusters that we can identify. A sort of a cluster that we call the high-tox cluster, the mid-tox cluster, and a low-tox cluster. And we're able to show that these are actually really prognostically relevant. The patients that have the high-tox cluster have inferior overall survival and progression-free survival, higher non-relapse mortality, even when we account for multiple product disease-related features on multivariate analysis. And we're able to find that these clusters are biologically distinct. So patients that went on to develop the third cluster at baseline, they had an interferon gamma-like signature. When we looked at this in serum proteomic studies, we also find that CAR T-cell hyper-expanders, according to CAR T-cell peripheral blood flow, were enriched for this high-tox group, indicating sort of dysregulated immune dysregulation and dysregulated CAR T-cell expansion in this prognostically relevant cluster.